Health experts are warning of a potential tripledemic this winter, with the seasonal flu, RSV, and COVID all on track to surge at the same time. Now add in those holiday gatherings, and the fear increases that we are in for a massive transmission. KCTV5's Carolyn Long sits down with a local expert with HCA Midwest Health.
Already this fall, local ERs have been inundated with flu, RSV, and some COVID, making for a potential winter tridemic or tripledemic. Dr. Darryl Nelson with Centerpoint Medical Center and HCA Midwest Health says we suffer worse here in the Midwest, likely because it is colder here, leading more of us to huddle indoors. Plus, the pandemic has changed us.
We've had a lot of mitigation strategies, at least that have been in place during parts of the season, including masking and distancing. As a result of that, we have decreased our exposure to other viruses or infections. So it's probably creating a little bit of a decrease in our natural immunity as it relates to flu and other viruses that we may have been more routinely spreading.
Add to that, fewer flu shots have been administered at this point in the season compared to last year and the year before, according to the CDC, which many experts blame on vaccine fatigue.
Influenza is a series of viruses that typically, although sometimes assert that they cause a lot of gastrointestinal problems, the influenza that we know is really more of a respiratory illness as well. It tends to hit all age groups, and the highest risk populations actually are young children, pregnant mothers, older adults, and then any individuals with chronic health problems. And influenza can cause you to get respiratory symptoms as well. Generally, there's a higher fever, although not always. And then there's usually that dreaded aches and pains we talk about. Everything just hurts. My skin hurts. I'm really uncomfortable. And then the other typical symptoms of cough and congestion, oftentimes a pretty significant sore throat.
And don't be fooled, the flu can still be deadly. It's not something you want to mess with. The CDC shows the flu generally accounts for up to 50,000 deaths each year. Compare that to the symptoms of RSV, which can spread like wildfire. We've seen recent local school closings because of that virus.
It's a long recognized virus that causes upper respiratory symptoms, typically in younger children and in infants. It starts with common cold-like symptoms, but it can progress to severe coughing and wheezing. It can create a pneumonia type infection, and as a result of that can cause youngsters to become very sick. So I think starting with the littlest of the littles, obviously if they're coughing or so congested they're having trouble nursing, if they're starting to show blue discoloration around their lips or mouth or nose, that can mean they're not getting enough oxygen. If they're just inconsolable or irritable, or if they're not able to eat or drink enough that they're stooling or wetting, then they probably need to be seen by a healthcare provider.
Add in COVID variants, and we could be in for a rough few months. So Dr. Nelson still recommends you get your flu shot, your COVID boosters, and stay isolated when you are sick. Plus,
stay hydrated, try to eat well and get rest. Sometimes we just go during the holiday season, and lack of sleep has been shown to decrease our immune system's effectiveness.
Carolyn Long, KCTV5 News.